Mrs. Amra Music and her son Dino will be the first to share their experience with us. Welcome here. Take your seats. Thank you. Good afternoon. Mama Amra, your son had a vision problem. Yes, that's right. What was it? He had this problem as a baby. He was born with congenital cataract. I had a regular pregnancy until the 8th month. At the end of the 8th month, amniotic fluid was gone, so I had to give birth. He was crying for 2 months, rolling his eyes, and we didn't know what was wrong with him. My dad told us that the baby had vision problems and that we should take him to a doctor for an examination. We took him to a doctor, and the doctor told us that he had congenital cataract. The doctor in Tuzla told us that it had to be operated immediately because it was thick. Then we went to a polyclinic in Zagreb, but the doctor told us that we had to wait for the cataract to be mature, that it was too early for surgery, and that it wasn't done to babies. He told us to call him after Christmas or New Year, so I realized that he didn't want to operate him. Afterwards, we went to Ljubljana, where the doctor established the same thing. She also said that she didn't want to accept the surgery, that it was too risky. Then we came back home, and the very same day we heard about Sveti. Everything was happening while he was still a baby, when he was 6 months old. Yes, he was 2 months old, and we lost 2 months and a half waiting for the clinic in Zagreb to call us, but I realized that it wouldn't happen. I'd like to know how you felt then. You were a fresh mom, you had your baby, you were happy that the baby was alive and healthy, and then you realized there was a problem.
Upravo to kad ste spomenuli, mene interesuje kako ste se tada osjećali. Dakle, bili ste svježa mama, dobili ste svoju bebu, bili sretni što je dijete živo i zdravo i onda se ustanovio neki problem. Kako ste se vi u tom
momentu osjećali? How did you feel then, especially when you heard all those medical opinions that you had to wait, that nothing could be done at that moment? I felt very bad, and then I felt bad while we were waiting for the clinic in Zagreb to call us. And when the doctor in Ljubljana said that she wouldn't accept the surgery and that she doubted there was any help. What did you think then? Did you have faith that it would be solved one day? I don't know. I don't know how I even came back from Ljubljana. It was very hard. That day my whole world went down into pieces, and it was hard for me to accept it. After that, we immediately heard about Sveti Vid. We called them, my father talked to Dr. Dragovic, and she told us that we had to come for an examination. We came back from Ljubljana that day, and everything was happening that day. We made an appointment in 3 days. During the examination, Professor Roosevelt also established that there was congenital cataract, a heavy one, and that the child also had smaller eyeballs. He said it was very complicated, but he would accept to operate him. We arranged the surgery in 4 days. Did you think twice about that surgery? No, no. You weren't frightened since the child was so small. No, I didn't have a choice. He could be only better, not worse. I was full of expectations. I didn't have anything to lose. While we were at the hospital, some analyses were performed which were good. We came after 4 days, and they operated his both eyes. The doctor said that it was only that he was born, and it was when he was 5 months and a half, and a newborn baby can't see. So his vision will be coming to him over time. And so it happened. I didn't notice that he couldn't see. He wouldn't open his mouth for a pacifier, for a bottle. I didn't notice anything. Only after 3 months we noticed that he was able to see, that his vision was coming to him. Synechia cornea were operated, adhesions that narrowed his pupils, and also pupil plastic surgery was done to him in order to dilate his pupils. When he was 1 year old, he had already had 3 surgeries, so he couldn't start talking in time, and his motility was underdeveloped. He had to do some physiotherapeutic exercises. After some time, we thought he wouldn't be able to go to normal school, but I didn't want to believe in it, so I enrolled him a year earlier to see how he would manage. When he started his 1st grade, he managed fine. Now, he's in the 7th grade, he can read, but he still has
kao da će moći da ide u normalnu školu. Međutim, i to nisam vjerovala, pa sam ga čak i godinu prije upisala da vidim kako će da se snalazi. I međutim, kad je krenuo u 1. razred, sada je 7. Snalazio je se dobro, vidi, čita, istina slabo vidanje, ali neka vidi na svoje oči.
Da, upravo tako.
Talking about school, I have to ask you, how is it at school? Great. Do you remember your first day in the 1st grade? I do. So what was it like? Your mom was afraid, thinking whether you'd manage it. Can you remember? Can you describe us some details? How did you manage when you saw your teacher? I was fine. I met some new friends from my kindergarten. And how is it today in your 7th grade? It's fine too. I have a lot of friends. I'd like to say hello to them now. To my class 7B, my full master, Mr. Novalije Gavranić, and my Bosnian teacher, Ms. Raha Hidanović. Greetings to all the teachers. Which subject do you like best? I like all subjects, all of them. And what are your grades at school, if I may ask? Excellent, excellent, way to go. I'd like to use this opportunity to say hello to my dad, mom and grandpa who are responsible for this. What do you mean when you say responsible for this? They were taking me to the hospital Sveti Vid. So they were your support. Yes, they were. Tell me, Dino goes to control examinations regularly now, doesn't he? He goes to control examinations regularly. He doesn't have any problems. He can see now, which is the most important, and we'll see what it will be like later. As you've said, the most important thing is that he can see with his own eyes. Please welcome Dr. Marina Dragović. Welcome, doctor. Here's the first question. Did all our guests who had vision problems have cataract? There are other problems here too, but we're primarily focused on the anterior segment problems, cataract, dioptric problems, cornea problems. We're focused on visual blurring, which gradually leads to the loss of vision, to the impossibility of moving on your own, functioning, and if you leave it that way, without intervention, it could even lead to degenerative problems in the cornea of the keratoconus type, or pellucid marginal degeneration up to gradual progressive vision loss or thinning of the cornea, danger of breaks in the cornea, and need for transplantation. This is what has been changed in a revolutionary manner in medicine and ophthalmology in the last 10 years, so that fortunately we don't have to hurry with transplantation anymore, and we start excluding transplantation at least in these situations if we timely apply a method which is called corneal cross-linking. It is exactly the corneal cross-linking method that doesn't include surgery. It's an intervention with special light with a special lamp. It acts on the cornea, whereby the effect of reinforcing the collagen fibers is achieved and new links are formed, while the old links are reinforced between collagen fibers and the cornea, thus making it stronger. In this way, we prevent further impairment and thinning of the cornea, and we prevent any breaks in the cornea. There is no need for transplantation. So, in these situations, it's important to stop that process, and the answer to the question if people will be able to see immediately after the intervention is no. Their vision will be blurred, the cornea will be still fresh. We have to put a protective contact lens, and we have to apply the therapy with drops in order to restore vision gradually. Delayed response is obtained in 3 to 6 months. After that, it isn't crucial to obtain a thicker cornea, but a stronger one, which is resistant to further procedures and to that genetic mechanism which tends to make it thin. After the cornea recovery, another moment in keratoconus which should be reached is a solution to the diopter problem. Therefore, the cornea is cured, but we have to give young people the opportunity to be able to see. What can be applied today is laser correction, as far as lower diopter values are concerned, but with higher diopter values we stick to the rule of not performing laser surgery in the cornea which already has this primary disease. And this is an innovation again. It's about a special type of contact lenses, GP lenses, but not the standard ones. These are the so-called Rose K2 lenses. They're new in our area, they come from an English company, and these are lenses especially prepared for problematic corneas. They're not intended for any type of astigmatism, but for corneas with pellucid marginal degenerations and keratoconus, and they're particularly intended for use after this kind of procedure. As you can see, vision is 100% restored.
Rehabilitacija vida je 100%.